The PQRSTU assessment. The PQRSTU assessment is a tool to help further explore a client's symptoms or signs. A common one follows the mnemonic PQRSTU, which offers a systematic approach to asking assessment questions without leaving out any details. P is provocative or palliative, Q for quality, quantity, R for the region or radiation, S is for severity, T is for timing or treatment, and U is for understanding. The PQRSTU assessment mnemonic. The mnemonic is often used to assess pain, but it can also be used to assess many signs and symptoms related to the client's main health needs and other signs and symptoms that are discussed during the complete subjective health assessment. Provocative. OP. Provocative. What makes your pain worse? What makes your breathing worse? Palliative. What makes your pain feel better? What makes your nausea better? Quality. What does the pain feel like? Suggestions such as aching, stabbing, burning, or follow-up questions such as what does the itching feel like? Quantity. How bad is your pain? How bad is the itching? Region. Where do you feel the pain? Point to where you feel the pain. Where exactly do you feel the nausea? Radiation. Does the pain move around? Do you feel the pain elsewhere? Do you feel the nausea elsewhere? Severity. Use a severity scale. How would you rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever experienced? The severity scale is an important assessment of pain and when used can provide evaluation of a treatment's effectiveness. After eliciting a baseline, you may provide some sort of pain control intervention and then reassess the pain to see if it was effective. How would you rate your breathing issues on a scale of 0 to 10, with 0 being no problems and 10 being the worst breathing issues you've ever experienced? Timing. When did the pain start? What were you doing when the pain started? Where were you when the pain started? Is the pain constant or does it come and go? If the pain is intermittent, when did it last occur? How long does the pain last? When did your breathing issues begin? What were you doing when the itching first started? Where were you when the itching first started? Is the nausea constant or does it come and go? If the nausea is intermittent, when did it last occur? How long did the nausea last? Treatment. Have you taken anything to help relieve the pain? Have you tried any treatments at home for the pain? Have you taken anything to relieve the itching better? Have you tried any treatments at home for the itching? U stands for understanding. What do you think is causing the pain? What do you think is causing the rash? The order of questions asked will often depend on the symptom or sign and the flow of the conversation with the client. You also want to be aware of responses that don't seem to align. For example, if a client responds to the question about quantity of pain by saying, "The pain isn't too bad," but then rates the severity of their pain as being 8 out of 10, you should probe further. It is okay to say to the client, I noticed you rated your pain fairly high at 8 out of 10, but you said it wasn't too bad. Can you tell me more about that? Again, these are very common questions you can expect to receive as a patient in a healthcare setting. Younger children or clients with developmental delays or disabilities, clients with cognitive impairments may not be able to answer the types of questions shown. The care partner might be able to help answer some of these questions, and in that case, you should explore why and how questions. For example, if the care partner indicates that the infant's pain started 2 weeks ago, we should ask, why or how do you know that it started then? Or, if you are working with a young child, you will need to modify your language to be more understandable, such as asking, instead of where does it hurt, where is your owie? One can also assess pain in young children using the Wong-Baker Faces Pain Rating Scale. When using this scale, the client is asked to choose the face that best depicts the pain they are experiencing. You may need to explain what the faces mean. Face 0 doesn't hurt at all. Face 2 hurts just a little bit. Face 4 hurts a little bit more. Face 6 hurts even more. Face 8 hurts a whole lot more. And face 10 hurts as much as you can imagine. Alternative scales exist to assess pain and other symptoms that are more relevant to certain cultures. There's the sun-cloud pain scale. On this sliding scale, 0 indicates that the clients feel very well, whereas 5 indicates that the client is feeling very unwell. The sample is a mnemonic or memory device which is used to gather essential patient history information to diagnose the patient's complaint and make treatment decisions. Like OPQRST, taking these sample questions is the start of a conversation between you, the investigator, and the patient or the research subject. Sample, the S stands for signs and symptoms. The A stands for allergies. 3 stands for medications. 4 stands for pertinent medical history. The L stands for last oral intake. And 6 stands for events leading up to the problem. Sample questions are asked of any patient. Though if a patient has airway, breathing, or circulatory life threats, gathering a patient history is secondary to treating those time-sensitive, life-threatening conditions, like removing an airway obstruction or performing chest compressions. The results of sample can help identify the cause of a medical condition, like anaphylaxis secondary to ingestion of an allergen. The questions can also help diagnose a reason for traumatic injury. For example, alcohol consumption might have caused a fall and fracture, as well as potentially predicting respiratory depression and airway compromise. Use the information you have gathered with sample along with vital signs and physical exam findings to make treatment decision. Remember, OPQRST and sample findings can confirm indications for a treatment as well as contraindications, like a medical allergy to a pre-hospital intervention. Finally, don't limit the patient history taking with sample or OPQRST T to the size of the form fields in the electronic patient care report.